are more prone to fractures as there is osteoporosis happening in them with aging process. Spinal fractures are the most common type of fractures called vertebral compression fractures, occurring an estimated 1.5 million times each year in the United States. They are almost twice as common as other fractures typically linked to osteoporosis, such as broken hips and wrists. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to discuss about how fractures in the elderly are preventable with simple X-rays. Findings in a new thesis from the University of Gothenburg indicate that a simple X-ray method should be introduced as a routine procedure in Swedish healthcare. More elderly patients can then be diagnosed and given the most efficacious drugs. The thesis confirms previous research showing that 25% of older women between 75 and 80 have vertebral compression fractures. However, the majority are unaware that these are causing their back pain. Only 1 in 3 is diagnosed. Based on population statistics from Statistics Sweden, that is SCB, there are at least 40,000 older women in Sweden who do not know that they have vertebral compression fractures. Few elderly patients who have suffered fractures, their hip and lumbar spine bone density is examined with the dual energy X-ray absorptiometry, that is DXA method, to find out if they need treatment for osteoporosis. Dual energy X-ray absorptiometry can then also be used to get a side view of the chest and lumbar spine with a method called vertebral fracture assessment, or VFA, in which the height of the vertebrae is analyzed. The thesis is based on the superb population study which included 3,028 women in Gothenburg between 75 and 80 years old. The study shows that the women with vertebral compression fractures had lower hip bone density to a greater extent, and their physical functional capacity and health was poorer. The women who had an identifiable vertebral compression, even if it was classed as mild, had a markedly increased fracture risk entirely independent from other risk factors and bone density. The authors said that vertebral fracture assessment is of great clinical benefit, and the results suggest that the method should be introduced as a routine procedure in healthcare nationwide. It provides a very low radiation dose, and it's fast, cheap, simple and effective in finding vertebral compressions. It's a valuable method for diagnosing relevant compressions and significantly improves fracture risk assessment in older women. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.